Hello. These are general postoperative instructions after an oral surgery procedure. After any procedure, it's normal to experience pain, swelling, bleeding, and possibly infection. For pain, you have most likely been prescribed a pain medication, and you should take that as directed. Additionally, I highly recommend ibuprofen if you are able to take that. And if you are able to take it, patients who have a history of gastric ulcer or are on blood thinners may not be good candidates for taking ibuprofen. But if you are able to take it, I personally would take 600 to 800 milligrams 4 times a day for the next 5 days, no matter what. And then I would use the prescribed, often narcotic pain medication as a supplement for breakthrough pain. For swelling, the height of swelling occurs at 48 to 72 hours. So if you had your procedure on a Wednesday, for example, it would be normal to wake up Friday morning and Saturday morning being the most swollen, and then often on that 4th day it'll be about the same, and then we'll begin to go down. Sleeping with your head elevated, either in a lazy boy or with at least 2 pillows, will significantly help with the swelling. There should be minimal bleeding after an oral surgery procedure. You will almost always be sent home with gauze, and often we will instruct you to bite down on that gauze. If you're concerned about bleeding, the first thing that I recommend is to get a clean gauze and clean out your mouth really well. Go all the way around the base of your tongue and your cheeks and wipe out all the blood. Try to identify an area, if there is one specific one where it's bleeding, and fold the gauze and bite with firm pressure for at least 5 minutes. And that will often, or almost always, either completely stop the bleeding or get it to a very, very slow ooze. If after doing this you're still concerned, please call our after hours number so that you can discuss that with myself or Dr. Waters or our staff. And the last issue is infection. Infection is not common after an oral surgery procedure. Far less than 1% of patients develop any kind of infection. Sometimes you will be prescribed an antibiotic to take. There are many pros and cons about whether or not to prescribe you an antibiotic, and that decision has been thoughtfully made for you. If you have been prescribed one, please take it until it's gone. However, antibiotics will often upset your stomach, and if they are making you sick, if you're developing any kind of complications from the antibiotics, please discontinue them immediately and give us a call the next day and let us know. So those are the general instructions after any oral surgery procedure covering pain, swelling, bleeding, infection. And it's also important to talk about hygiene, but that is usually more specific to each individual procedure and can be found in the videos that specifically address each procedure.